And I'm going to turn this over to Bob to do his welcome and so we can sit down and hear his presentation. How does that sound?
Sounds good. Glad to see you, Caleb. I'll just tell you a little bit about Caleb. He's, of course, with Carle Hospital. He is currently the Senior Vice President for Surgical Services, Specialty Institutes, Medical Specialties, Primary Care, and Behavioral Health. I don't know what else there can be in a hospital, but anyway, I don't have too much more. He's been with Carle since 2005. Caleb, if you want to add any more at the start of your talk about your background or anything, you're welcome to do that. And he is going to talk about coronavirus today. That's a word that we probably didn't know much about it a year ago. And here we are, see that word so many times every day now. So Caleb, you can go ahead.
Yeah, and thanks for the introduction, Bob. And thank you all for allowing us to Carle as an organization to come and share with you our journey that we've been on over the past few months. It's been, just to be honest with you, been a little exhausting, but it's also been rewarding. The fact that what we can contribute to the community. I've been very proud of the work that we've done. I've been really proud of our community, actually, really overall. The response that we provided just to keep the health and safety of the community. It's just been great across the board. That covers us, U of I, our public health district, just our community citizens. Everybody's just done a tremendous job, and there's a lot to be proud of, being a Champaign-Urbana resident. A little bit more of my background. I actually somewhat local. I grew up in Vermilion County, the southern part of Vermilion County, Jamaica, Illinois, if you guys are familiar with that area. Went to SIU, to Carbondale, and had no intentions to come back to Champaign-Urbana, but my wife got into the U of I in the master's program, and I tell people I got stuck, but I'm very happy that I got stuck here. It's been a great community to live in over the past 15 plus years. I've got 2 kids. Wife works at the U of I she's a professor there, and our kids are going to the local school district. I got a 9-year-old and a 6-year-old. So my life's very busy, and coronavirus made it that much more busy. But like I said, it's been a tiring but rewarding experience for all of us here at Carle. I got a presentation that I'd like to share my screen with, if that's okay with everybody, just to kind of walk through it. I think pictures, help kind of dictate kind of our experiences with the coronavirus. Can everybody see that? Okay, great. Let me make sure. Okay, so COVID-19 really entered the United States in January, February of this year. So I know most of us felt the hit in March. All the way back into the end of last year, this was tied in with Carle to some degree. At the end of last year, we have infectious disease experts within our medical staff, and they always track what's happening out there from the World Health Organization as well as the CDC, just to see kind of what's happening across the world, just what could happen, and what viruses or new bacterias or other infectious diseases could be brought to the United States, and how could we be well prepared and respond to that. Obviously, as medical professionals, they're trying to stay at the cutting edge of the knowledge that's happening within their respective areas. In January, we actually started to establish our hospital incident command system. So a lot of people probably think, March is when it really started to hit, but we're all the way back in January. There was a U of I student that actually was obviously here receiving education. He had went off to travel back to his home country of China, and it was within the Wuhan province that many of you guys are very well familiar with as you followed this. And he actually was coming to one of our clinical appointments, was having symptoms, and we actually started to track, determine was this what we were hearing of this new virus over in China. Thankfully, nothing came of it at that time. The patient or our patient did not have COVID-19, the coronavirus. But that really started to kind of learn a little bit more of, what is this new virus? How could it impact Carle? We obviously have a very large Asian population that is served by us through their education that they receive at the University of Illinois. So we started to start to track it a little bit then. We weren't intensively tracking it by any means, just because there wasn't much activity within there. But I wanted to give you this group kind of understanding of kind of where it kind of first came onto our radar. We do have, as an organization, a pandemic plan. So as any obviously large healthcare organization, you prepare for the worst and always hope for the best. And those, our biggest things that we've had over the years is, issues with a large amount of, field workers getting impacted by a crop duster. We've also had, every once in a while we'll have a bomb threat, or, we've had many times being in a rural community, we'll have farming accidents, or we'll have, motor vehicle, multiple car, interstate traffic accidents, which, that resolved in, multiple casualties, et cetera. So we cover the gamut as relates to what to be prepared for as a level 1 trauma center. And it's no different as relates to infectious disease and a pandemic plan. What would we do? Last year was the measles. A couple years ago was Ebola. Or 2 or 3 years ago was Ebola. But as an organization, this is another thing I'm very proud about is, as community members, you should feel safe. Carle's at the forefront of this, making sure that we're well prepared for anything that we come into contact with. Unfortunately, sometimes, like the coronavirus, there's a lot of unknown, and that's not just for us, but the CDC, the World Health Organization, et cetera. So you kind of fly by the seat of your pants, and you go along and try to figure it out as things come up. Also in February 14, we started to communicate a lot with our internal team. That was obviously, a smaller degree. We ramped up some of our purchasing resources, and then we started to work with U of I as we learned a little bit more on the predictive modeling and, what are some of the best practices associated with what we're seeing with that. Mid-March is when we had our first case in Champaign County, March 15th. The picture there that's shown on there is our local healthcare leaders, Julie Pride. We had members from OSF, ourselves. I think the U of I was there that day, Christie Clinic. We had that first patient, and I was lucky enough, each one of our vice presidents rotate call as it relates to, dealing with these type of issues, hospital census, patient care issues, et cetera. I was the guy that week. So I was the individual on call for our first patient. It was a individual who had just came back from Italy. She had been traveling over there to, for pleasure with a couple of friends. She started not feeling well. She actually came in within one of our regional clinics. And on that Saturday night, we got confirmed positive that we had our first COVID-19 case. So that obviously started to ramp things up quite a bit more. When it felt a little bit more real at that time. You heard a lot about what was happening within New York and some of these other areas, but when it started, that first case that started to hit home, it was like, what is this? What is this all going to mean? We continue to collaborate with Julie Pride, our regional healthcare peers. We really, at that time, trying to say, what can we do to be as preventive as possible? We started coordinated resources for care amongst all those groups, and that led us into the strategy of really our focus was to prevent spread, protect staff, and prioritize care. If you, were obviously attuned to the news outlets at that time, you're hearing everything this was going to be complete chaos. We don't know quite what we're going to do. So once again, we prepare for the worst and hope for the best a lot of these situations. So our rapid response, all of us on the senior leadership team, as well as many members of our operational team, worked countless hours. I did not see my family a lot at that time, but that was okay because, you know, this was it's part of our job. It comes to the territory. It's our mission to provide patients with high quality care. And each and every one of us at Carle was going to do everything we can in order to kind of meet those goals, you know, prevent the spread, protect our staff, and really protect our community. So in March, April, we start what we call our rapid response. We did front triage respiratory treatment centers. These pictures show you guys probably saw this, you know, on the news, or if you had come to Carle, you saw a little tent outside our ED. This is the inside of that tent. The tent, the picture right there in the middle was the tent. We called that the RTU, the Respiratory Treatment Center. And then that picture on the right shows a little video monitor. What we were doing at that time is as patients were either calling into our hotline, coming to our ED, coming to our triage, our convenient cares, we would have front triage. So people would be getting stopped at the door, or we'd be encouraged them in order to call our community hotline. And as soon as, if they had any of those symptoms, we were sending them to this RTU. And what would we do there? We'd mask them as soon as they arrive. We'd start tracking them even from a phone call standpoint, just say, you know, come by yourself if all possible, come masked. We'd get them in there. We had a team within this tent. We'd bring them in. And then we would have our ED providers just because at that time, the protective, the PPE that we had available to us was not in abundant supply. So in order to reduce that, we kept our ED providers in our ED while the patient would be out in this tent. And we put them in front of that computer screen and be able to kind of go and triage and do everything there. We would have a staff and other members that would be out there in the tent to help, you know, kind of be hands-on with the patient. Our ED providers would go out there if they need to be hands-on, but this allowed us to kind of cut down on the usage of PPE because each and every patient you had to don and off, take the PPE off, and then that'd be, you know, burning through those resources. And it was a little bit of an arms race. Everybody was trying to, you know, running for the gold. Everybody was trying to find their N95s. Everybody was trying to get their ventilators, et cetera. So that was one, it was a mitigation strategy, but at the same time, it was a strategy also to keep, you know, our patients as well as our team members safe, and that would help prevent the spread. We developed COVID-19 units. So if we did have a patient that was in our hospital, we start to develop units. So those patients would be isolated and not amongst the other inpatients that we had. We developed new PPE processes. A lot of it was a salvage strategy, but at the same time, we wanted to reassure our staff and ensure our staff that they had the necessary resources they had. Their safety, once again, was one of our top priorities. We wanted them to come to work and feel extremely safe. That they, and we always would say our goal was to make sure that anywhere within the community, when they are at work, that was going to be the safest place for them because we were going to get them the right PPE. We were going to make sure that we were going to protect them from patients that we felt, you know, that we suspected had COVID-19 symptoms, et cetera. There was unfortunately some reuse efforts as it relates to how do we, you know, salvage supplies and make sure we, you know, get the most out of it. Every healthcare organization was doing that just because of the unknown. Obviously, we are by no means in New York, Washington, the state of Washington type situation, but we, you know, there was, you know, the fear of that. UV lights was a big thing where, you know, they had asked, you know, they had found out that UV helps kind of kill the virus. So we use UV lights to re-sterilize our N95s. You could do that. CDC recommended you could do that a number of times before you had to throw the N95 away. We put a very strict restriction on hospital visitors. We did that even before the IDPH guidelines that came out, and then IDPH told us that we could have no visitors essentially. And then we've always, at Carle, we've always offered virtual visits and a variety of methods to deliver that, whether that be a email, a video visit, We also had telephone calls, but we ramped that up and made that a little bit more robust. And that was very helpful for us to continue the care that we needed to, because just because we had a pandemic, that didn't take away people with chronic diseases such as hypertension, diabetes. We had cancer patients that we continuously deal with. Obviously, just because we have a pandemic, people who have cancer, that doesn't go away. We have all kinds of healthcare issues, and that was one of our biggest fears is, yes, we're dealing with this pandemic, but at the same time, what about those individuals that are out there that are on a day-to-day basis dealing with, the challenges that they're having from a health standpoint? So we wanted to make sure that we offered every venue of care for them, to make sure that they were optimizing their health and receiving the care that they need. Preventing spread, just to give a little bit more, visuals around this. You can see there on the left, this is one of our environmental services workers, with the UV lights going into one of our hospital rooms, kind of making that, getting that as that room as clean as possible. The room on the right, that is a little anti room that we developed within our OR. So we would have suspected COVID-19 patients that would obviously need surgical care. And we would have our team go into that room. They would don and doff the PPE before and after the cases. And that would allow them to kind of keep separate from the main OR. Just because there was a lot of unknowns at that time, but basically how things transmitted as it relates to the virus and how airborne it was, and how much it transmitted through contact through surfaces, etc. And that was something very unique. That was actually, we hopped on a conference call with other organizations as it relates to Quality Collaborative that we're a part of, and we shared kind of best practices in the May timeframe, and that was one that the Northwesterns and others of the world had not put into place, and they said, we wish we would have done that. So we did a really nice job on identifying opportunity there. The other thing we did, we had limited interest added screening. If you came to appointment during this time, you knew that, we were pretty rigid around that, and some patients did not tolerate that well. Some, understood completely, but at the end of the day, our job was to really make sure we were providing, once again, the safest environment for our patients and employees. So we did have to change how we brought patients into our clinics. We still do that to a degree today. And you can kind of see we had patients, employees entering in different pathways. We wanted to, once again, not make sure we stop the spread. The little tent there on the right, that's our Mattoon clinic. So we had these little tents and little shed buildings outside of a lot of our regional locations, our primary care locations, and most of those were where we had convenient cares. And if anybody presented with symptoms, we'd bring them into those sheds or those tents, and we would triage them there, just once again, so we didn't have patients come into our lobby waiting, for 15, 20 minutes or even 10 minutes. And that was just one way we could kind of cut them off at the door. And just to make sure, once again, if you're in, for your primary care appointment to deal with your diabetes care, if you had to come in that day, you weren't sitting next to a COVID-19 positive patient. And this also allowed to, keep our staff safe. So some things that we did to protect staff. We had, Carle has over 8,000 employees. We're up to 10,000 employees now. That includes Health Alliance. We basically, anybody that could work from home, we shifted home. So the Carle at the Fields building, I'm sure many of you are familiar with, that's where a lot of our support services, that building overnight, basically turned into a graveyard. There was nothing, no one really there. It was a ghost town. So that was another big challenge that we had, is how do we get everybody to start to work from home, make sure they maintain their productivity, make sure that we can continue to operate our business operations. And that took a lot to work on our IT department. We were obviously well equipped in a lot of areas because people were already working from home, but how could we do that in an expedited manner for the departments who had never historically done that? A lot of those same practices are still in place today. You've heard of like Google and Apple and a lot of the tech industry kind of making that to their kind of their new normal as it relates to how they're going to manage their employees and where they give them office space. We will do a little bit of the same where it makes sense. So we continue to work through that. But we have been bringing some departments back and making sure they keep things safe. One of the well, let me get to the third bullet point first. We also, during that time, we had to reassign jobs. So as some areas were, a reduction in the things that they were doing went away. So like an example, with the stoppage of pretty much all sports as it relates to team sports, both on the travel team standpoint, as well as high schools and elementary schools and our local community athletics and everything. That kind of came to a screeching halt. One example is, one example is our athletic trainers. So their jobs changed overnight. They basically didn't have a job other than, when they provided therapy within the clinic or acted as a staff member within our clinic for our physicians as it relates to clinical care. But they were no longer going to football games. They were no longer going to basketball games, covering those events. So we wanted to make sure, our goal was to make sure each and every employee at Carle, we did not furlough. We tried to keep them a consistent paycheck. This is probably the biggest thing I'm proud of. Every one of our employees, I felt, was treated with tremendous respect. Not only did we have a pandemic and there was healthcare challenges out there, but there was financial challenges from this. And our goal was to, at the end of the day, make sure we retained each and every one of our staff if all possible, and make sure that they didn't have no interruption paychecks. So we did that through a variety of ways. We reassigned them to new jobs. So as our athletic trainers were losing their typical day-to-day job, we reassigned them and helped with security and at these 4 triage centers, and to make sure that we had a presence there to help with traffic control. We also reassigned them to help enter lab results as we were getting COVID-19 tests. So we had a lot of different things pop up, that new jobs that we never needed beforehand, but at the same time we needed now, just to, once again, prevent spread, protect our community, and protect our staff. We paid our entire workforce through the whole state mandated closures. We did not have one employee furloughed during that whole time. Our senior leadership team, our executive team, we took pay cuts, and that's something that we had to do to kind of mitigate our financial loss that we were having. But we made sure that our frontline employees weren't impacted at all. And we did that through a variety of means. And that's, like I said, one of the things I'm most proud of as an organization, because at the end of the day, we're not a strong organization without strong employees, and employees that love the work that they do and love the organization that they work for. The other thing that we did, this was, things that we could do for them, not just from a paycheck standpoint, but we offered any employee that had a family member that was, contracted the virus, or if they themselves became a patient that was infected, we offered them lodging. So we worked closely with some of our local hotels. This was, it was a pro for both us as well as the hotel. The hotel was allowed to get some business at that time. At the same time, we offered our employees the opportunity to not bring that, that virus home to their family members, and that would help us prevent the spread. And then we also had, we also extended this to any staff member that just felt anxiety or, a sense of concern about bringing that home. We offered, to be able to put them up into lodging, and we had some criteria around that, but we wanted to make sure our staff felt safe. And as they worked in these areas that, were suspected COVID-19 patients were coming in routinely, the ED or convenient cares, that they have that option to have separate lodging from their family members at that time. We also developed what we called Scrub Central. And I should have said, stop me at any time if you guys have questions. So please do interrupt me. I know we're covering a lot. We also had a thing that we called Scrub Central. So we, a lot of our employees, particularly in the units, they wear scrubs to work. And at that time, we didn't, once again, we didn't know a lot about how the virus was transmitted, and we wanted to make sure they could wear their work clothes, or they didn't have to wear their scrubs home from work. So as they worked in the units all day, they didn't have to come home in those same scrubs. So we had, you can see there kind of the table. Our staff members would arrive to work in the morning. We had little changing rooms. They'd be able to, grab a pair of scrubs, grab their size, go to the room, change, at the end of the day, come back, get their clothes, and then, go home and not wear the same scrubs that they've been working all day dealing with these types of patients. We have EAP, which is Employee Assistance Program. A lot of our staff members, just like people continue today, the mental health aspect of this pandemic has been one of the bigger challenges as well. So we offered, as we always do, we offered an Employee Assistance Program. We developed special programs just around the pandemic, what individuals are going through, whether that be financial challenges, just safety challenges, et cetera. We also offer childcare resources for all our staff. We repurposed our Echo Chaos building, the Expanding Children Healthcare, Expanding Children Hearing Opportunities building, as well as our Chaos, so our school for children with hearing impaired issues. We repurposed that, so anybody that had healthcare challenges, we offered on-site healthcare. We offer take and bake meals, for employees. They could go down there. We made those very cheap. We provided to them at cost. And then we also applied for a grant at that time. And any employee that was eligible, we gave them basically a box of fruit and a box of dairy products, once again, to help them just, to maintain, their finances, and to help them with, not having to go to the grocery store after coming from work.
Caleb, I hate to break in, but you've got about 2 more minutes. Okay,
we'll go very quick.
Okay.
Sorry, lots to cover here. The other thing, just to cover, we got a surge plan. So we developed a surge plan with the U of I. So at times, you probably heard of McCormick up in Chicago, but at a flip of a switch, we could turn the ARC, the recreation center, into a 700-bed hospital. So luckily, we didn't have to go there. We can still go there. So feel safe that as a community, we can get things going pretty quickly. These are a few other things that we did with the U of I. We work closely with them around testing, both our testing on the PCR, as well as we've helped support them from a saliva testing where we can on that front. They helped us develop PPE, and then we also had a ventilator that we developed with the College of Engineering that we could have used if we would have got into a real pinch, and that's on the right. These you've seen our drive-through services. That picture in the middle shows our COVID-19 swabbing clinic. You guys are probably well familiar with this. And then we also start offering our lab services at a drive-through out at our Windsor clinic. It's been a real collaborative approach. This kind of shows you all the things that we've done, with the U of I as well as other community members. It's been pretty amazing. We developed a fund within our own employees and asked our physicians and other members to donate to it. We, as an organization, we got over $140,000 in employee disaster relief fund. We actually were able to give employees that were had low, staff level employees that were having income challenges. There was criteria, but we were able to distribute funds to them. These are the masks that we got from the community, which is tremendous. And then during that time, we were just getting meals after meals after meals from individuals and local businesses. This once again talks about some of the generosity. This is, yourself as well as others. And then going forward, we're going to continue to have to manage this. We don't know when this will end. So this talks about some of the things that we're continuing to do. All the things that we've been doing, we're just doing them on a different level in a different manner. So I hope it ends sooner than later. I think much like everybody on this Zoom call. But please know at Carle, we're well ahead of this, and we're trying to make sure we do everything possible to keep you and our community safe. This shows you our current situation. As of yesterday, we have 20 people within our hospital that's got COVID. 5 of those are within our ICU, and 15 are within our med-surg units. So this is something that we deal with on a daily basis, and that we're, that managing. We've seen those numbers be pretty steady over the last few weeks, and we hope that stays that way. So that's my presentation, and thank you. There's a little video, but we'll save that, and I can send this presentation out to you guys, so you have it. But any questions? And sorry, I took up a lot of the time here, but we had a lot of
Great.
stuff.
No, that's awesome. And I'm going to ask if we could, I'm going to go ahead and close the meeting, and then we'll go ahead and come back to questions if you don't mind hanging around for just a little bit longer. Would that be okay?
Yes, I've got time until 8 o'clock, so I'm happy to spend as much time as you guys need. So
Awesome. If you would like to stop sharing your screen for just a moment,
yes.
and we will come back and we'll kind of close up this meeting from our end here. Give us just a second here. And let me share this. Okay. And there we go. Our next week's speaker is Brian Serafin, Chief of Police of Urbana. So please join us for that. Carrie will be presenting him. And now I am going to turn this over to Ed, who is going to give us the four-way test.
Four-way test. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And is it fun?
And on that note, I am closing the meeting, and then we can go back and continue asking Caleb questions. Is that okay?
Absolutely.
Great.
Thank you, Caleb.
You're very welcome. So thank you guys for giving me this opportunity. We like to share our story.
Yeah. Hey, I got a question.